A follow-up now to our exclusive story we brought you yesterday. The province is looking at saving close to $500 million from OHIP coverage. Those savings could involve cutting back on some sedation used in colonoscopies. But as City News also mentioned yesterday, there is an appropriateness working group looking at which OHIP services are overused or unnecessary. And it's not a new concept, Cynthia Mulligan now, with how there is actually a movement promoting the same thing around the world and across Canada.
Choosing Wisely Canada. It was launched in 2012 by a team from U of T, the Canadian Medical Association, and St. Michael's Hospital. There are groups working under the Choosing Wisely banner in 20 other countries, including Australia, Israel, Japan, and the UK. The mandate isn't about cost savings, but rather more is not always better. One of the group's startling conclusions, up to 30% of tests, treatments, and procedures in Canada are potentially unnecessary. And that, it claims, works out to more than 1 million potentially unnecessary medical tests and treatments a year. In Canada, the group works with 70 societies across the healthcare spectrum, representing cardiologists, nurses, radiologists, and more, with the goal of combating unnecessary care. Choosing Canada concludes some tests and procedures do not add value for patients and consume precious time and resources. They've come up with over 300 recommendations. For example, don't do imaging for lower back pain unless red flags are present. So why so many unnecessary tests? The group believes habits are hard to change, even with new evidence, and patients may demand the tests. As well, payment systems can reward doing more. At times, tests can cause more harm than good. For example, unnecessary chest x-rays can increase the lifetime risk of cancer. The group is encouraging patients to ask their doctors 4 questions. Do I need the test? What are the downsides? Are there simpler, safer options? What if I do nothing? The group's mandate is not to advocate for cost containment, although that must be part of the provincial government's reason for an OHIP review, which hasn't been done since 2018. Healthcare is the biggest expense in the provincial budget, coming in at close to $60 billion last year.
Of all the recommendations on Choosing Wisely's websites, none suggests elimination or reduction of sedation during a colonoscopy. Now, it is just one recommendation being considered by the appropriateness panel, and given the public outcry, it may never become a reality.